So as was mentioned, I'm going to share a little bit about just a few barriers, talk about that because it's really important that we understand barriers in order for us to move forward. The other thing is I'm going to talk a little bit about partnerships, the value of partnerships. Of course, we all know the value, but I'm going to talk a little bit about a few strategies to help you think differently. The other thing that I want to do is share with you some examples of really cool, what I think are cool partnerships happening around the country. You're probably not going to see yourselves in here necessarily because you all know each other. And you're going to have a conversation all day and for the, in perpetuity, right? So I want to share with some things going on across the nation in terms of this work. Also, San Francisco State's in the house. Our department chair, Rose Guard, faculty, students. Give yourselves a big hand for being here. You got to love our students. All right. Let's see if we get this thing going. All right, so first I do want to give a shout out for people who are familiar with the California Recreation Roundtable on Parks, Recreation, and Tourism. 2007, I've been doing this work for about 30 years, and it wasn't until 2007 that I first saw health providers and park professionals come together in the same room. So this is really important and valuable, and that I hadn't really seen much since then, but now as we come through Indiana, they had what they called the first national symposium in 2015. Now, there must have been something going on between now and, but at that point. And then, of course, there were many people in here in Oakland just last year also at the George Wright Society. John Jarvis, in fact, was a discussant for this. A lot of folks here, the Conservancy was involved. Parks is key to preventative health care, partnerships between park and health professionals. So now, keep the momentum alive. Thank you for being here. It's going to be a great day. Continue as you listen to the speakers this morning. Continue your conversation this afternoon. It's going to be a lot of fun. So one of the things I want to mention, though, is we hear these terms, equality and equity. All right, just look at that photo. This is actually a pretty well-known graphic. You may have seen this before. I see a lot of heads shaking. That's great. This is important to realize that equity and equality both relate to producing fairness. However, equity is giving people everything they need, right? It's all about need to succeed. Now, I'm going to take this a step further and say, break down that fence, create greater equity, even better. Get them tickets to the game. All right, so these are some things that we often see and hear in the media. There's a lot of issues, a lot of challenges today, very difficult circumstances. There's a lot of good things, don't get me wrong, but we see this stuff in the media day in and day out. But with challenges come opportunities, as they say. I wanted to mention a few things in terms of some of the research. As I follow trends, I also teach an urban rec and parks class, and a lot of what we get into in this course, we talk about social issues. These are some things that are happening of what has come forward as a top 10 issues focusing on cities today. And so some of what we see is obviously fiscal issues, deteriorating transportation, infrastructure, middle class, we hear about that, right? Affordable housing, are we really taking care of our vets as they come back? Gang violence, crazy. If you're following what's going on, it's like nonstop. This notion of broken immigration system, broken, whatever's going on, we got some challenges around immigration. Climate change, extreme weather. By the way, Park Service, don't use climate change. Don't use that language. Or no, Congress. Congress doesn't like to use climate change. It's all about climate science, right? We're going to talk about science is important. You heard some of the data from Nusheen. And then lack of public trust is a big one. And lack of public trust, if you think about that, there's a relationship to developing partnerships with that. So one of the things that I do want to mention is this is what we often see as well. We see this happening in our neighborhoods. We see this happening in rural places in our nation. But really what we want to do, however, oh boy, this thing is quick. No wonder Nusheen had to pass the clicker. Right? We want it to go away as far as I'm concerned. Make it go away. We need to reduce stress in our lives a little bit more. We need hate-free zones, of which that sign I found in a Richmond community center, teaching young people that hate is not allowed in these places and these spaces, and parks as well. So enter park prescriptions. They're going to solve all the problems. Maybe, maybe not. I don't know. But they're doing really good work nationwide, right? Park prescriptions is an amazing opportunity. You heard a little bit about the partnership between East Bay and the Children's Center. So it's something that's getting bigger and really going coast to coast, which is really outstanding. And so some of what we're seeing here, but in order to understand and engage and find our solutions, again, it goes back to understanding what some of the barriers are. Now, what I want to share is that this is really not including lack of time, because lack of time is the #1 barrier across race, class, gender, every human species. Nobody has enough time. But time is a cultural variable, so keep that in mind. So what I want to do is just share a few things that surface to the top of many of the constraints research that's out there, especially when it comes to visiting parks and public lands. All right, so for example, wow, socialization as a child, lack of comfort or feeling welcome. Right now, when you hear people say, "Oh, they don't feel welcome," ask people what that means. Relevance is a big buzz right now as well. Communication, access, which means a lot of things as well. Pennsylvania one year had a whole conference on just access. Education, lack of knowledge, lack of information. Some of these should be familiar to you. All right, and this also, you'll see the connections in terms of the health communities as well. Lack of marketing. People will often say, is this not marketing to certain communities? Whatever that target market might be, there's not enough marketing. Fear and safety, that's a big one. Oftentimes when I work with racially diverse communities, people will, they're worried about the bears and the snakes and some of that creepy stuff that crawls under rocks. However, they're also afraid of people out there. They're afraid of people, right? And so a friend of mine, a colleague, once said from his father that, the woods is important, being outdoors is important, but there's a lot of trees out there and rope is cheap. That's a constraint right there. That's a constraint right there. So the historical context is no joke. Perceptions or real discrimination is no joke, right? So we have to think about looking and really selling those benefits as it relates to the work that we're doing. Lack of information, however, as I follow these trends, lack of information is what surfaces to the top the most. And so that's a message to all of you in the work that you're doing. Yes, these constraints are real, but how do we get the message out there? Who's the messenger? Very important. So the power of nature is, we know that we're all here. We understand the power of nature. And so sometimes to solve problems, we do have to do it locally. So that's also something to keep in mind. How do we solve problems locally through the power of nature, where parks can be part of every equation? So Nusheen talked about a variety of research. I'm not going to throw a lot of stats and a lot of data out. So the key is, I like this because parks and rec and tourism professionals have been studying the value and the benefits of parks for decades, right? And so yet, when the business world steps in, they're not just benefits, they're scientifically proven reasons, right? That's important. We got to have science too. I mean, it's all about science, different kinds of science. But the biggest thing is that, keeping in mind, it first makes you happy, and it makes you healthy. But if you want to see what those 11 reasons are, come see me later, all right? So now what? What do we do? What's behind the curtain? Public health approach, right? Typically build partnerships, use data, mobilize communities, you have interventions, evaluate, replicate. Now check this out, all right? Parks approach, it's pretty similar. Build partnerships, use data, mobilize communities, implement programs, evaluate and replicate. You see what's different up there, right? Generally speaking, we don't necessarily use interventions per se, right? But we have a power of implementing programs to enhance quality of life. Now, it's all about enhancing quality of life, but that's a lot of what we do well. So trust, going back to that, right? Lack of public trust is number one factor to consider when we're building partnerships. And that's hard work. It's very hard work. All right, authentic. Why are you asking, and will it make a difference? That's important. Now, one of the things, so what I'm going to do is I got to give a shout out to Baycat, who's filming this. Thank you. Everyone give it up for Baycat for being here filming this event. This is a great partnership with Baycat. I'm going to show you a quick 3-minute video. And this was in partnership with the U.S. Forest Service, our department at Rec Park and Tourism at San Francisco State. These guys, talk to them after if you want to know more about the work that they're doing. So I'm going to show you this video, and then we'll come back and we'll talk about some of the other partnerships between health and parks going on across the nation.
Has everything, newborn clothing, playing with my games and doing anything, like finishing homework or doing stronger, cause you already know I do work. My house is a perk, in life which is a curse. In my eyes, I wanna fly, but I'm too shy, so I'ma just stay inside.
People fighting, please stop all of that violence. I'd rather stay at home, play my game inside. silence. People fired it. Please stop all of that violence. I'd rather stay at home, play my game in silence. I'm gone.
I don't wanna go. You never know what outside's waiting for you, but I gotta try to fly high.
Just maybe there's something around the corner, bright and shiny. You'll have fun in the sun. Just take away your technology. Come with me and you'll see. Or is it better just watching your TV? Just maybe, just maybe, just maybe, just maybe.
People hitting me up saying let's go. I'm like nah, I just wanna chill for real and stay home. Rather grab my beats and zone out like oh, instead of looking for trouble out that door. Cause every time I step out, dark clouds come towards me. Plus I don't even know what's in store for me. It makes me think about it twice. Cause people are not so nice. They make it seem like we're not equal, and that's not right. Sometimes I just wanna stay inside, shut everything down, and turn up the music all the way up high. Just maybe I'd rather kick back at home and rock to the beat like whoa.
Afuera de mi casa, hoy en día la calle está peligrosa. Ahora todo solo hay violencia, por eso yo me quedo en mi casa y lo pienso con paciencia. Estar en mi cama es mejor que caminar en la calle con temor. En todos lugares tiene que parar la delincuencia. Por eso hicimos esta, para crear conciencia.
Just maybe there's something around the corner, bright and shiny. You'll have fun in the sun. Just take away your technology. Come with me and you'll see. Or is it better just watching your TV? Just maybe, just maybe, just maybe, just maybe.
Those students, they created that. Everything they did, everything, they produced it, they wrote the lyrics, that was all about those kids. There's 13 of those videos, zoom in 29. This one is called Outside Your Door. So I love showcasing this. There are 2 music videos. This is one of my favorites. They're all great. At any rate, so BayCat does this wonderful work. And these students, again, understanding and learning from them. It is, you know, young people is one thing. The conversation around youth is always an ebb and flow. But this is something that we're paying a lot of attention to, and there's a lot of funding out there. And you heard some of the data that Dr. Razzani spoke of as well. So what I want to do is principles and strategies. I just want to talk about a few things again. Some of this should be reminders for you. Some of this may be kind of an aha moment of yeah, that's really important. In terms of moving forward with some of this work. Without community involvement and partnerships, there can be no innovation or change, right? We all think that we are the experts and we're the pros and we could do it all ourselves, and that's just not the way things work. And so without changing, and also it's understanding community needs, right? And again, a lot of this is intuitive and fundamental for the work that you may be doing. The long-term viability, the sustainability, could be in doubt. It could be, you know, the risks are great and the loss could be greater unless we're involving different communities. So I want to, and again, some of these are reminders, but partnerships in terms of why are they so important? Why are they so vital? Strengthen programs, save costs, right? Strengthen infrastructure, administrative costs, expand the value of any organization that may be working together, improve efficiency, complementary skills and abilities, right? And increase leadership skills. And I gotta say, Forbes is great, but this came from Forbes Women. Just gotta shout out for the women leaders, which we also need more of. Quote of the day here: with each failure, you move one step closer to success. It's when you give up that you truly fail. All right, and it's gonna happen. We're gonna fail in the work that we do because it's really challenging, right? So the key is to not give up. In terms of these best practices, this came from the late, great Brian O'Neill. Many of you in the room know who Brian is, former superintendent, passed away at a young age, I might add. But Brian put together these 21 best practices for the 21st century, all right? And I pulled out 10 of the ones that I like. Now, the thing about these best practices is that if you really break it down, and I do have a copy of the full, this is available online on the National Park Service website, but just take a look at these, focusing on important needs. Right? Go need a formal agreement. At some point, it took us 4 years to get to a formal MOU with the National Park Service in our student internship, but we never gave up. We did it. We moved the program forward, but now we have a formal agreement. Right? So it could take time, but you cannot give up. So that's also important. Understanding mission and organizational culture. Right? It may or may not match, but it's important if you want to work together that these are the things we think about. Finding ways through the red tape. Okay, we all know that, what that's like, depending on the agency. Diversify your funding sources. Great story around Chattanooga. They actually shared their funding list and pooled their funding sources. They all raised money, but then they all put it together. And things happen quicker in that particular neighborhood. Strive for excellence. Honor your commitments. Show up. Respect the right to disagree. Put mechanisms in place. You have to reinforce the partnership, but then leave your ego and control at the door. Very hard to do, because we all know what's right. We all know what's best. Very important. These are just a few of the many examples that Brian O'Neill put out there that are practiced across the nation today. Now, there's a lot of text here, but this is what I want to bring your attention to. This particular paper, by the way, came out this past spring. Surmounting Barriers to Public Health Park Agencies Partnerships, Insights from Accounting. This, Nushin, Dr. Rosani, Dr. Chan is in the house, Curtis Chan is in the house, right? So a group of folks across health and park professionals wrote this paper based on some research they were doing. And a couple things I want to mention, and we're happy to give you a copy if you want to see this, because research is important, right? In that it shows activities across the health department, the agency, and the community-based organization. Right? And the three key things I want to bring your attention to is this says form alliances, right? You have to form alliances between these three, starting with that, right? Create consistent messaging, right? Messaging, communication is huge, very important. And this third piece here is build capacity. I often hear, that capacity is one of the biggest challenges, and we understand that. But don't let it be an excuse. Don't let it be an excuse. So you can build capacity by working together with these different agencies. All right? And oftentimes keeping in mind who are the populations you're trying to work with, oftentimes the most vulnerable, the ones that need us the most. So here's a few examples. I want to share with you some partnerships as I wind down the last few minutes. This is cool. I had never heard about this. So you do see park and health professionals coming together. Very important, right? But you had health doing their own thing and parks doing their own thing. But here you have this training webinar by medical doctors for medical doctors all about parks and nature. Because sometimes we say, well, we know best, so parks are going to talk to parks, doctors are going to talk to doctors. That's great. That's important. However, let's talk about parks amongst the medical community by experts who know what's important as well, and really being able to build that capacity and the connection. Massachusetts General Hospital up in the Boston area, Appalachian Mountain Club, and Mass General teamed up, right, as part of the park prescriptions effort. So some of these examples, you're going to see some of those opportunities that are brought up. And one of the things here is the Appalachian Mountain Club, they've trained pediatricians, medical healthcare providers, volunteers. So they're doing a ton of work up there in New England. This is kind of cool. The goal of their first year was to actually just provide these opportunities for 1,000 young people, but they got over 3,000 people through their involvement. So it shows a level of popularity as well. Activities, of course, you're familiar with that, what's going on here in the Bay Area. Multiple languages, again, very important. But when they found out what was going on and the word spread and the messaging got out there, you actually start to see them spreading throughout New England, including Philadelphia and New York. And so what this was just a press release last year, because now they're doing it annually. 2013 is when they first started, is WGBH is an NPR public radio station in Boston. So get your radio stations involved. We're going to talk about that in a minute as well. So again, the National Park RX initiative is happening all over the nation. So I encourage you, if you're looking for some new ideas, just pick a city and plug in Park RX. You're going to find some really cool stuff going on. So Washington, D.C., where I'm duty stationed right now, as they say, just for the fall semester, they're doing some amazing things too. And I highlighted this, and I don't know if this is happening here in the Bay Area, but what's really neat about what they're doing is the physicians, again, they're talking about parks and the value of parks and park prescriptions, but they actually created this particular interactive website that people can find parks in their backyard. I mean, how many times would people say, I didn't know that park was, in X distance from my house, or I didn't know about the park. They can just go into their neighborhood and find the parks within walking distance to their house. That's the way that works. I thought that was really smart as well. This is cool, and I was thinking about the folks from San Francisco Rec and Parking House with that new development of Dolores Park. This is happening out in Miami. Glow-in-the-dark tennis event. And anybody familiar with that? This is great. And so what's really cool about this is that it was part of a new management plan, right? Bring visibility to help showcase a new facility. Not that you really need thousands more people going to Dolores Park, but what a cool way to use those brand new tennis courts. But look at the partners, Friends of Miami Tennis, the United States Tennis Association, Miami-Dade County Parks. Again, partners, and how they pulled this off. And they do have videos, so if you're curious about it, definitely look this up and check it out. It's pretty neat. And thinking about the healthcare providers, right? I don't see them on here as partners. Get a team. Be a sponsor. Put a table up in here, right? So think about how you can be part of these sorts of events. Youth Diving with a Purpose. This is actually in Biscayne, Florida, right? I just actually heard about this in an event I was at in DC. What they're doing is they explore the natural marine ecosystems, underwater archaeology, partnerships, notice the partnerships, Park Service, NOAA, Divers Alert Network, Florida thing, but also the foundation. Right? Now, what's neat about this, too, is just thinking about they've also gotten national awards. They do lessons on mapping and data collection. But where's the health, again, health benefits for sure, but how do we get more health providers to participate in what they're doing as well, just to even know that it exists? Now, something like this, Youth Diving with a Purpose, look at the waters, the marine habitat that we have here and all the youth programs. Does anybody know? Because I've never heard of a youth program that does diving here in terms of the Bay Area. So think about that, partners. Get together and create a youth diving app, a youth diving component. Green Latinos, anybody familiar with Green Latinos? Now, this is not about real estate, okay? However, the work that they do is with and in parks, in our public parks. This is an annual event now that occurs in the Grand Tetons, so it's central in terms of the U.S., and they've got, the sponsors are on the bottom. You may or may not be able to see them. But when I looked at who the sponsors were, my question was, where are the health professionals? You guys could be there too, right, as far as the providers, because we know that the work that we're doing together is very important. So I'm just trying to get you to think about all the different ways that parks and health and building ambassadors and park advocates and enthusiasts across cultures can occur, and the health community can be part of that as well. So this is from actually Colorado and Utah. It's family-centered wilderness therapy. Now, wilderness therapy, you heard some of what Nusheen was saying and what Kaiser mentioned earlier as far as the work that you're doing. If you're not familiar with wilderness therapy as a profession, as a viable business, what I like about this in Colorado and Utah is that it's all about the family. Many wilderness therapy programs actually work with the young people themselves directly, and they meet other young people. That's important, really valuable. But then you have the adolescents and their cohort. But this brings the whole family together, and it is evidence-based. It is based on clinical modalities. So there's a connection there in terms of healthcare providers for you to think about as well. So they talk about families and how the rewarding that adventure is in terms of self-discovery and bringing families together in new ways based on some of the challenges and struggles that young people are facing today. Healthcare providers, join the reference. Add your logo here. Go for it. Give them a call. Check it out. So this one here, what I want to mention, Outdoor Behavioral Healthcare Council. This is pretty new. This is the direction Parks and Health Connections are moving. Outdoor Behavioral Healthcare Council. They're moving to the idea of accreditation with healthcare providers, physicians, to make this happen in terms of standards and accreditation. Now, if you're familiar, especially outdoor educators in the house, the Association for Experiential Education, they have accreditation standards right now. So they're working with AEE, is what it's called, to help build new accreditation standards around the health component to the work that they're doing. So think about this as well. This is, their conference is in North Carolina in 2017. Okay, so as you think about upcoming events and what the funding resources are and what the possibilities are, they have an event in North Carolina, and, start small, become an exhibitor, right? So that's something to think about in terms of how can you get connected, how can you learn more about what they're doing. This is a little bit of an anomaly. I'll say an anomaly because we think about public health and public lands. Land trust, most people don't put land trust in the public domain. However, this is, I would call this quasi-public. This is quasi-public in the sense that these are private lands that were put into land trust for explicitly for public use. Okay, and so the LA Neighborhood Land Trust, which is one of the newer land trusts, they've created these urban parks and gardens out of vacant lots. So we hear the language of park-poor communities, right? But they do involve the residents in the development of these spaces. Again, it goes back to that level of collaboration that's so important. Fremont, and it's a wellness center and community garden. We could do that here. I don't think in the Bay Area I've heard like wellness center and community garden, wellness center, but they've combined the two. Here's another, this is why this is a great example. All right, and so they have a health clinic there, a little mini health clinic. Doctors come, sometimes pro bono, where there's funding available to support neighborhood park education. They work with the local high school who helps and oversees some of the gardening efforts. And they also, what I think is great, is that neighborhood land trust, they connect the small scale, the farming businesses in the Central Valley. They bring food for the locals, and these kids learn about farming, right? It's another way to connect city kids to what's going on, as well as job skills training. Girl Trek. From Civil War to civil rights, right? Girl Trek. How many people work with Girl Trek? Show of hands. If you're not working with Girl Trek, check them out. Thank you. All right, this is another one that's very, very important in terms of, it is a national movement, all right? You're activating thousands of black women all in the name of walking. So there's, again, as you heard from Dr. Razani, there's lots of different ways, and as we all know, all the different kind of benefits, but this is explicitly to get people moving. So one of the things that I do want to mention, let me just see where I'm at here with this fast clicker. As you think about promoting, I'm going to wind down here. As you think about promoting your programs, talking about them, telling the stories of what you're doing is so important. New American Media Conservancy, if they're still in the house, new board member, and I know there's, Mona has done some work with them at the East Bay Regional Parks. You got to think about non-traditional forms of media. If you're not familiar with New American Media, check them out and start to tell your story within these forums. This bottom resource here, Untapped Natural Resources, a brand new study that was just published in the spring about minority voting habits, behaviors, attitudes, and experiences towards the environment. And you're talking 80, 90% of people in terms of protection, preservation, conservation, the importance, the value of the environment. And so they are behind some of that research as well. So one of the things here, my point is, as we think about nature and promotion, that what you saw, the computer, the technology, the social media, a lot of millennials in the house. If you were born between 1982 and roughly 2002, raise your hands. All right, you know who you are. They are digital natives to the core, meaning they are the first generation ever who has been born into using digital technology right out of the womb. And so as a result, what we're learning is that you have to connect with them through some form of technology. For sure, we hear that, we know that, but it is real, including the workplace. Hire them, work with them, and understand what they need, and understand the power of the hashtag, right? That's very, very important. And so what we saw here is, as we think about that, sometimes we want to do this. If you're like me, you just want to it's crazy. It's nuts. But it's important that we understand how people communicate best, and how do they engage, how do they connect. Imagine California is the healthiest state. There's your hashtag. However, Colorado, I believe, is still the healthiest state, but imagine California is the healthiest state. What do we need to do? We need to do more of the things that we're talking about here today and beyond. This last couple of things, if you're not familiar, this is actually really interesting. California Health and Human Service Agency, this is just a busy model. It's a really busy model, but my point in this is that, and I've added that, they have these 6 goals. Okay, their goals on this California task force, they've created this framework all based on research. And if you look at this healthy beginnings and living, from the very beginning, living well, end of life, creating healthy communities, lowering the cost of care, very important, all crucial, all crucial. And my point is those are your 6 as it relates to health across the lifespan, health equity, eliminating discrimination. But here's that 7th that I want to add, visit parks often. Right? That's what I was saying earlier. How do we really create an integrated connection of parks to health and the work that we do all the time, all the time? I want to close with this quote. Anybody know Majora Carter? She is an environmental hero of the Bronx, well-known nationwide. This I love. It says, we might have come from very, very different stations in life, but believe me, we all share one incredibly powerful thing. When we work together, we have nothing to lose and everything to gain. everything to gain. And I want to leave you with those words as you go on today. Have a great time. Enjoy yourselves, and make sure that you continue to fight the fight, as they say, but as Gandhi also said, make sure that you are the change you want to see in the world. Thank you for being here. Have a great time today, and I look forward to seeing you later.